Hi guys, Dr. Kramer here, Doctor of Functional Medicine, Chiropractor, Acupuncturist, and founder of Senara Health and Healing in Peoria, Illinois. Today in this video, I'm going to share with you the 5 ways to heal disc or back pain naturally. And this video is for you people that have herniated or bulging discs, low back pain of any sort. I personally have had low back pain myself. About 15 years ago, I severely injured my lower back lifting weights. And these tips that I'm going to show you today, I actually implemented immediately, and it really helped me heal much faster. Step 1, we're going to talk about a home exercise program. So strengthening the weak muscles and stretching the tight muscles. Standard American lifestyle, we actually sit about 8+ hours a day. So with that type of posture, we're actually going to get really tight across the front of our chest and here. Our abdominals are going to get weak. Our buttocks is going to get weak, and our lower back muscles are going to get tight. So these exercises will be catered to kind of opening up the chest, strengthening the abdominal muscles, strengthening your buttocks, and actually loosening up your lower back to kind of get that pelvis to tilt forward. This biomechanics will actually protect the spine and help the discs heal themselves faster. This poor posture that we've developed over our repetitive lifestyles has actually caused these repetitive muscle patterns to happen, which causes the disc to herniate and actually causes the lower back to go into spasm. Step number 2 is corrective chiropractic care. And what I mean by corrective chiropractic care, I mean chiropractic that involves the biomechanics of the spine and the physics of the spine, kind of like the exercise program that we're going to give to you. Those home exercises work on the physics and the biomechanics of the spine. And it's important to get your spine corrected by a chiropractor that actually adjusts you with the thought process of changing your posture and changing the muscles to work better to help protect your lower back and also to help those discs heal more appropriately. And chiropractic care actually manipulates the spine, and those discs get their nutrients through motion. So the idea of getting an adjustment and inducing motion into that injured area makes sense, because it actually allows the disc to get good, healthy nutrients, healing nutrients back into it. And step number 3 is spinal decompression, or layman's terms, sometimes people call it a traction table. Spinal decompression is 88% effective for herniated discs, both in the neck and the lower back. It's a great modality to use. What it does is it creates a negative pressure inside those discs. Those discs are cushions in between your spinal bones. They actually give your spinal bones a little shock absorption. Well, the way the discs get their nutrients is through motion, like I said earlier, and if you stretch the back apart, it actually creates a negative pressure inside those discs, so it'll actually pull the disc material that's actually herniated or putting pressure on the nerves or spinal column. It'll actually pull that back in, and then on top of that, it'll give it nice healing and good nutrients to help the body heal that area much quicker. Step 4 is an anti-inflammatory diet. As you can see over here, I have nutrient-dense, highly nutritious foods over here that'll help the body heal and repair much faster. Blueberries are one of my favorites. Blackberries as well. They have a high level of antioxidants in it, which help the tissues heal. Avocados are also really good for that. You have walnuts here. Salmon is also very good. It has high levels of omega-3 fatty acids in it, which help the tissues heal. If you can't afford the salmon or don't like fish, omega-3 fatty acid supplement would also be a really nice way of doing that. Olive oil. We cook with olive oil a lot. Actually, we go through a lot of olive oil. It's very healthy, very good for you, filled with polyphenols and high levels of antioxidants, which help the tissues heal. Dark green leafy vegetables, beets, broccoli, kale, bok choy, Swiss chard, all have high levels of antioxidants in it, which will help the discs and the tissues in the lower back heal much faster. That's why this is considered an anti-inflammatory diet. And on this side here, these are pro-inflammatory foods, or inflammatory foods, like processed cereals, granola bars, apple juice, macaroni and cheese, salty prepared lunch meats. These are all going to create inflammation in the body. Pre-made drinks like Starbucks here, or Monster, or Red Bull, these are going to be pro-inflammatory. You see this yogurt down here, it's pasteurized dairy. If you don't have a dairy sensitivity, not such a big deal, except there's a lot of sugar in this, which is also pro-inflammatory. And then breads over here. If you don't have a gluten sensitivity, not a big deal. You can have this. This particular bread's actually good. It's 100% whole wheat. However, don't be tricked by some of these because sometimes they say whole wheat on the label and then you look on the back and it says enriched flour, which is not 100% whole wheat. If you don't have a gluten sensitivity, it is okay to have 100% whole wheat bread. Step 5, we're going to talk about supplementation here, and I'm going to talk about 2 supplements that we have here in Senara. One of them is called Turmeric. It has 3 plant-based enzymes in it. One of them is bromelain, which is from pineapple, quercetin, which is from the blueberries, and then curcumin, which is from the turmeric root. All 3 of these have highly anti-inflammatory properties in them, so if you have a new injury or a disc injury, this is going to be a great supplement for you. And the other one is more for your chronic injuries. It's called Chondroflex. It's got chondroitin sulfate in it and glucosamine sulfate, which your body produces naturally in the joint spaces. And since discs are located in the joint spaces, it'll help rehydrate them and help them heal much faster. In fact, it's been shown in studies to be more effective long-term than NSAIDs or non-steroidal anti-inflammatories without any side effects. So, if you're suffering from bulging or herniated disc or low back injury of any sort, come see me, Dr. Kramer, at Senara Health in Peoria, Illinois.